And the first item on the agenda is approval of the minutes of the last meeting.
Motion
I
to
would-
approve.
Second.
Motion, I think, by Dr. Horning, seconded by Dr. Keller. Any additions or corrections? Otherwise, all in favor signify by saying aye.
Aye.
Opposed? Motion carries. Public comments. Anyone from the public online or on the phone that wishes to make some comments at this time? Otherwise, we'll move on to agenda item number 4, Brighter Futures Youth Justice Grant and job descriptions and positions.
Hello, everyone.
Scott?
Can everyone hear me all right?
Yep.
Great. So hopefully you've seen in your packet, we have just taken a look at what our needs are with regard to staffing the Spark program and the Youth Justice Innovations program. We've been moving some people around a little bit with Amber Pickney, who's really taken on the lead with our Youth Justice Innovations program. We lost Cameron Smith, who's been with us since the program started in 2019. And she moved on to a full-time position out in Pennsylvania. And so with some of those changes, with the loss of a couple staff, Sydney Olp and a couple of others, we wanted to just really take a good look at what we needed. And so I made a proposal with some job description changes, some wage changes, and so I'm hoping that we can take some action to approve these changes so that we can post for some positions. We have our programs running, and we're doing okay with staff right now. Our numbers are at this moment for the first couple of days are good enough that with our current staff we're all right. But I know that as the numbers increase, once we have our 6th graders start joining us, which they start next Monday, that getting these new staff positions filled will be beneficial.
So if you had any questions about the job descriptions, I would just add one thing in there, and that is that we found out that the wage study has been completed. And my recommendation for all new wage increases or changes would be to wait and take a look and see what the wage study shows. So Dan just mentioned he can't hear. Can everybody else hear okay?
I can.
Yes, I can
Okay.
hear you.
Okay. So just to add to what Scott was saying, it is very important for us to maintain good quality staff. And that's extremely difficult to do when you're paying them 20 hours a week with no benefits. This is not an easy job. We are working with at-risk youth, and really the staff who work with them have to have a lot of skills. They have to model good behavior. They have to be skilled in de-escalation. You know, this is not just an after-school program like any other. This is, you know, something we created, and it is working extremely well. We need to maintain it, and we need to maintain good quality staff. So I totally support switching some of these to full-time positions with benefits. The wages for me are just a little, we just kind of need to use the wage study and maybe tweak it for some of these new positions that have, some of them have much more job duties and responsibilities.
And really the only one that we're looking at moving to a full-time position right now is the youth justice position under the Youth Justice Innovations Grant. And we just secured funding for a 2nd year of that grant. And so this is all grant funded. And the woman, Amber Pickney, for those of you who have met her, she's amazing, and she's incredibly dedicated to this role, and she is putting in a lot of hours. And we really would like to get her into a full-time position. With regard to the wages, I can see waiting for the wage study for possibly some of the for a few of these positions. Right now, some of our positions that are at the $15 an hour level, I would request that we approve that wage increase immediately. We've got McDonald's McDonald's and Quick Trip that are offering to pay $15 to $18 an hour right now. And so I've got people right now that are on this team that are dedicated. They believe in our mission. They've been going to trainings. They've been dedicated to this role, and they're struggling to make ends meet because we're paying $15 an hour for some of them. And it's just not, it can't in good conscience continue to try and pay $15 an hour for part-time positions for staff who are really demonstrating their dedication to this role and to these kids that we're working with. So I can agree with you, Terry, on some, if we're looking at any of those kind of those higher levels, but at that base level of moving the people who are at $15 an hour up to 17, I would request that we would do that right away.
I guess my only question is this something that we can approve, or does this have to go through the county executive committee?
My understanding is it's still going to have to go to the executive committee, Clarence. But this was the first step that Dan recommended, was to come here first.
I have a question. Were all these positions submitted into the wage study also?
The youth mentor position, the lead mentor position, the youth justice, the adjudicated at-risk youth justice support specialist is a new position. So you see the ones that are currently on here, those were included in the wage study. But it's the ones that are listed as new positions, those were not included in the wage study because we just kind of rewrote those job descriptions to kind of match the need of what we're finding. You'll see that the administrative and logistics assistant that we have on the bottom of that page, that's new. And the reason that we created that position that way is we had someone who was hired as a mentor, Cameron Smith, who was with us for a number of years. She actually was hired before I was. She was really taking on a lot of the logistics and administrative support that was in that role. And we realize now that was a critical role that she was filling, but we don't want to try and hire for a youth mentor when really what we need is someone who, she just had a lot of those skills and was taking on a lot of those roles. And so we want to just try and specifically hire for that position and not try and hire somebody for a youth mentor position and then ask them to fill those roles.
So with these positions and the amount that you got approved for the grants for this next block, how much more does this raise your department's budget? And that's at the base rates for these.
It's not gonna change what we've budgeted through the grant. It's not gonna require any levy funding. This is still all grant funded.
So you're
Anyone else
telling me
have
this
any
is
questions?
covered?
Yeah, it's all covered by the grants. We received a $25,000 DOJ grant to expand some of our hours. We've got a Youth Justice Innovations grant that we received another $112,000 for next year. We just received at the beginning of this year $375,000 a year for the Brighter Futures Initiative grant. So these are all grant funded positions. We're not looking for any levy funding to do any of this.
I see Pete nodding his head. So is that Pete, you're in agreement with that? You can nod again if you need to.
This is Huber. So these are all 100% funded?
Yes.
Okay.
Yeah, we're not looking for the county to support any of these positions in a financial or levy position. This is all grant funded. We're just looking for the approval to approve these job descriptions and the actual wages. So it's not requiring any levy funding.
How long
Okay,
into the
thank-
future? How long into the future is
Yeah.
that funded?
We're writing into each of these that these are grant funded positions and that they are contingent on that grant funding. So if the grants dry up, then the positions fall away. So they're not. And if you look at right in the job description for the adjudicated and at-risk youth and family support specialist, it's written right onto the job description that it's a grant funded position and that the position will be dissolved if the grant funding is no longer available.
Personally, I'd rather see us wait with any wage increases with everybody else's, because it feels really crappy just going ahead and giving people raises first before that wage study is all done through and everything is checked. Because as a county, we keep doing this. So if we do it all at once, it feels a heck of a lot better. Plus, it's a lot better for budgeting, planning, etc. And because otherwise we keep creating this process where here's where we're going to do this, but then, well, let's just one department this, or one section this, or one section that. And it kind of cruds up the process. So it still feels like picking winners and losers, even though you wrote the grants for it and I appreciate that, and you secured them, so even better. But I'd rather wait on this process for the wage increases on it. And I get about McDonald's. I come up against that every day.
And
Yeah,
I don't, I'm sorry.
I was gonna say, I'd like to see how these fit into that wage study before we say, yeah, go ahead and do it.
So I think, since we don't meet again till November, if you could make maybe a motion supporting these jobs, and my guess is, but I'm not privy to any information on what these, I tried to get it, but on what these wages would be, but some of them are case managers. So I'm hopeful that they will all get some significant increase, and they should if we wrote the job descriptions. For some of the newer positions that did not get into that wage study, I would recommend asking for another look from Carlson Detman to tell us where they fit, because they have all the scales. All of the scales will be there. And so I guess if I know Scott would like to have these set in stone, but if we could at least move this forward to the executive committee to take a look and make recommendations on equitable pay scales for these positions, that would be good. George,
We have
George,
the meeting tomorrow about the wage scale issue. I get that we have this, that don't have anything until November, but I still would rather wait on.
Oh, we lost you. We lost your audio, Laura.
I know, I don't know where it went, because that just turned itself off. My hand was over here. Unless one of you guys are doing it, so can't imagine why. But I'd rather wait until we see, because there has to be a good plan laid out across the county and across all employees. And it's, I've already said quite a few times, I already support getting people up to good wages and comparable to their peers and what you guys should be paid. So there is no qualms about that. It's just about what everything looks like, what kind of plan we can lay out, and the steps that we get to.
Can I just ask for clarification, Laura? Like when we're looking at a couple of these new positions that aren't currently, so we've got some vacancies that are positions that we've previously had, but with regard to the new positions, are you suggesting we wait till the wage study is complete before we post for those as well?
I would like to see it all put in a scale.
Okay.
We all knew this stuff was coming together, so as you guys made plans, you can make those plans, with this plan. I've been pushing on this for over a year now, so it's been in the works for a while.
Yeah. Do we have a time frame for when I know that Terry said that the wage study, that maybe you said we did get a report back from the study now, Terry?
Finance and executive are gonna see it
Meeting
tomorrow.
tomorrow.
Okay, great.
Tomorrow at 9 a.m. So
Okay.
And
All
I
right.
know Matt McKenzie just texted me and said he's gonna be a little late, but I'm sure he has some questions about it too. What's the wishes of the board?
This
As
is
far
Matt
as-
Morning. I guess I would be in favor of what Terry had proposed, which is sort of moving this to the executive committee, and then the executive committee can look at the wage study and make some of these final wage determinations. But that way these positions can hopefully get posted as soon as possible so that they can be filled, so that we can staff the program. And I guess I'll make a motion to that effect.
This is Huber. I'll second that.
Okay, so if I understand it, it's the motion that we approve moving these requested positions to the executive committee pending the wage study and how they would fit, how some of those positions would fit into that. Does that sound all right? Any other?
Yeah, that
questions?
sounds great. I mean, Terry, is that what you were kind of thinking
Yes.
would be sort of workable?
Yep, I think that would be a good way to proceed and then try to get some equity with the pay scale.
I have a question for clarification. Is there still a hiring freeze on? I know that was a while ago, and then some of these positions being new. This hasn't been brought up at all to exec?
Yeah, there is still a hiring freeze. And so any new positions, even grant funded ones, have to be approved by exec.
Okay.
Any other questions or discussion? Otherwise, all in favor of submitting this request to the executive committee, signify by saying aye. Any opposed? Was that an opposed or was that a late aye?
I'm kind of torn yet. And all of these positions are definitely necessary.
So the two youth mentor position vacancies, like we tend, because they're such low wage positions, we tend to rotate through them. And so, but the two positions to the Youth Justice Innovations Grant are definitely required for us to meet the requirements of the grant that we wrote. And then that logistics and administrative position, I think that's where we feel like we are going to be running at our top notch. And again, we're working it out through the grant budget to work it out in that way. So can we make it work without? I mean, we hustle to make things work just like everybody else in human services, like we know that we got to do the work that we got to do. So, we will survive and we will do it well, but this would position us well.
Okay.
Well,
So,
It
and
was
I'm
a late
happy to
night.
obviously meet with the executive committee to kind of talk through the details as well. So,
well, and as far as I could tell the ayes have it. So this has been moved on to the executive committee.
Thank you, everyone. Appreciate it.
Thanks, Scott. Next item is the overdose fatality review team findings. Is that Liz?
Yep, that would be me. So I just wanted to give a quick update, and I thought we had an action requested on here, but maybe not. So of the few cases that we've already reviewed for the overdose fatality review, we have identified a fairly obvious gap in services. So that gap is essentially being aftercare or specifically transitional housing would be where that gap is identified. So as part of the overdose fatality review team, what we would like to see is we would like to request that a designated amount of funding from the opioid settlement funds would be designated to the development of specifically local transitional housing. Within Ashland County would be great. Ideally, if that could be developed from a 1 to 2 bedroom, just a small setting to start with, adult family home, and then specifically priority to be given to female residents. Of the transitional housing options that are available, there tend to be more options available for the male residents of our community than female residents. And we've seen a significant lack or gap in that transitional care, where individuals, when they return to their community setting, they do have potential if they were to have transitional services in place. However, just returning to their previous environment, it does not set them up for success. And we have seen some very unfortunate cases as a result of that.
So we had considered making this an action item, but we decided, I think in the end, just to make this informational, that this would be something we'd like you as a board to consider as you move forward with looking at what you want to do with that settlement funding. We continue, unfortunately, to have a backlog of overdose fatality reviews because we have had such a substantial number. But even early on, we think this is going to be a resounding theme. So we just kind of wanted to plant the seed as you start thinking about uses for that funding. And I believe in the packet, there is a list of approved opioid remediation uses. This would fit into that well. And I know there's probably other uses that we could do too. Prevention. That's Scott's program that we're really working towards. This would be after the fact, when somebody is already an addict and in recovery, doing very, very, very well. We really need to do a wraparound system to ensure their success when they come back to our community. So that was that. Any questions on that?
Just a timing of the money. We've received the first payment of like $19,000, but the remainder of it, we won't know until the end of the year when we decide whether or not we want to collateralize or not. In which case, if we do, we get a giant chunk of money. So right now we only have about $19,000 to use. And there are other settlements in the works, so we'll be seeing more of this coming down the road.
And if I could just add one more thing to why we looked at a 1 to 2 bedroom adult family home, is we've already seen success, and it is extremely affordable compared to any kind of other transitional housing. It's family-like, and what we envision is this family would be skilled. We would train them well. They would help the participant to, if they haven't gotten their high school diploma, to get a GED, to help them get jobs in the community, and then find some very difficult to find housing But so not just throwing them back into couch surfing with their friends who are still using. So just something to think about. We really had a lot of good support from our team that thought this would be a really good plan for people returning back to our community from treatment.
Now I gotta unmute myself. We'll move on then to,
I have a couple questions first.
oh, go ahead,
I
Laura.
know you were looking for a house. Have we looked into any preferred partnerships with any nonprofits that might be able to provide these services throughout the state, or other things that other counties have been partnering, any people that have been partnering with?
We utilize whatever's in our community right now. There's a sober house for males. There is, and there's Bad River has some transitional sober living, mostly for males. This is a gap that we see for females. And again, we just in general, the population that we serve is increasingly finding difficulty finding anything affordable for housing. And I'm going to tell you, outright that a lot of landlords are not going to be willing to rent to clientele who have drug convictions, oftentimes felony drug convictions. It's just a very, very difficult thing for these clientele coming out.
Yeah, my question was more like with, say, when I was at Counties Association, Exodus House was there, and they have different houses along with treatment programs built right in with them. They can do smaller ones. They have up to, I've seen 20-bed houses just from glancing back through their webpage right now. Has that been discussed?
So we do currently use those type of facilities. They're extremely expensive. And they're not in our area. And we've looked in different capacities trying to get RAM, Aurora, different companies like you've discussed to come into our area. And they seem to prefer the bigger areas because they will have more clientele and more demand. We just, I'm open to that also, but that's currently all we have to use, and they're not in our area. We have one who is in our area. It's very expensive. We have used them because it's all we have. So we're just trying to be as frugal as we can, but have the best services that we can. And we're thinking we need to look at it with fresh eyes and be creative.
And then, Dan, have we tried to set up any regional task force for use of, or just groups to see if we can group fund with, say, Bayfield, Price, whatever, to pull in all of our funds together to get some kind of regional help on this also?
No, we have not yet.
Well, that would be a cool beans things to start. So
I can bring it up in our Monday meetings.
thank you. And thank you, Terry.
Any other questions? And we'll move on to 2023 budget review and approval.
Okay. We'll share my screen here with you. This is a slightly different look. It's pretty busy. What we have here is it's pretty busy, and also Clarence or Dan or Terry or some combination.
We can't see the document.
I'm not seeing it.
Oh, I'm sharing my screen.
There you go.
You see it now?
Yep.
Okay. And this is a little bit of a different exhibit. Dan, Clarence, Terry can jump in at any time because we do have this wage study thing, which may change, will probably change all of these numbers. But so in terms of what action will be requested, I'll leave that up to them. But as it stands today, I put together 3 different scenarios for our budget for 2023. One is at a 0% wage increase, just so we have a baseline. One is at 4.5% wage increase. One is at the top of the scale or the range, which is 8.6%. The way to read this is we've got for 2023 at 0%, we've got expenses by department, revenues by department, levy request by department. We're comparing that to the 2022 budget, expenses by department, revenues by department, and levy by department. So where we get to on the far right is the expense variance between the 2 years, the revenue variance between the 2 years, and the levy request variance between the 2 years. For me, the real key number is the difference in levy request, which at 0%, if we were to have no raises, our request for levy would be $177,000 less than in 2022. That is for 2 major reasons. One is for the community service programs downtown. At least for now, we have moved away from the CSP program. And right now, all of our clients are in the CCS program. CCS is fully funded. CSP is not. So there's a combination of things happening here. One is the staffing is lower through attrition. And also, like I said, for the time being, we expect that the vast majority, if not all of our clients, will be able to help through the CCS program, which is 100% funded. So that's a big chunk. That's a $86,000 net savings in the levy request. That's offset in part by slightly higher requests for adult services and children and families expenses and some accompanying revenues. And that's just because of recent years' experience. We do our best to kind of figure out with placements and things what number we should be looking at. The other big savings line would be in public health. We have for levy request, that's $189,000 less than the 2022 request. That is made up of 2 things. One is temporary. We put $125,000 in to the budget for 2023 for COVID monies. Public health has several COVID grants still going on. They're separate from the the county level COVID. That, just so you know, or we need to keep in mind, Dan and I have talked this over, that money is not going to be there forever. That's not permanent. But for next year, that's there. The other source of reducing that levy request is one of our public health nurses retired, and Liz is not going to replace that position. So there's some savings there too. So again, net, if there were 0% raises, we'd be asking for $177,000 less in debt levy than 2022. Same exhibit here, but for a 4.5% raise. Here again, I feel like the real important number is what are we requesting in levy? Same scenario. The only difference here is the wage increase. That would result, that would cost us about $90,000. So that would get our levy request down to, we'd still be less than 2022, but it would be $86,000 less. And remember that part of that 86,000 is actually the 125,000 in public health funding that is temporary. So if that goes away, then really we're flat or requesting a little bit more at 4.5%. The third scenario, same assumptions, except now it's an 8.6% wage increase. Again, with the information that was available as we prepared this, this would result in a $20,000, in us requesting $20,000 less in levy from our 2022 budget. Again, with the $125,000 in what I would call temporary funding, that would translate more into like $100,000 increase in levy if you take that COVID money out. So Dan and I and Terry were just talking today, and these things are very likely going to change after tomorrow, but this is where we stand today with our budget, and kind of depends on what the board decides for raises.
Any questions for Pete? I think what we talked about is that, like Pete says, this is where we stand today. And the only thing we can do is approve this and send it on to the finance committee. And then they can tweak it however they see fit. But I mean, this is our current budget proposal for next year.
If it requires a move to approve, I will do so.
Thank you. Is there a second? George raised his hand to second. So the motion by Dr. Keller, seconded by George, to approve this budget proposal and submit it to the finance committee. Any other questions or comments?
I have a question. When it comes to taking this to finance, is there going to be a little more detail than this, or just the general categories and the percentages?
Yeah, I mean, this, yeah, this is what I'm bringing tomorrow. Again, if we're going to get into some more detail, we need some more time. I mean, in terms of sitting down with people, tomorrow that finance meeting has a really big agenda, and so I kind of tailored this to be a summary level thing. This requires, if we're going to get into that, then that kind of stuff, that's going to require more time to go through that. This is not, there are lots and lots of moving pieces in the financials for human services.
And Laura, we have the detail, but it seems the direction we were given was to develop this budget And now with the wage study, it seems like this is going to be thrown out of the water anyway. So to get into the details of it all, yes, we have them, but it's my understanding it most likely is going to change based on the wage study. So
And I think there's a philosophical question there too, in terms of how we do budgeting, period, in the county. At what level, I mean, what level of detail is enough? What level is too much? I mean, that's a very difficult thing. I'm happy to kind of go wherever, but this stuff becomes a rabbit hole really quickly. So, I mean, we could easily spend 8 hours sitting there. And my other question about that, and it's an open question, I don't know the answer, but I've worked with Dan on this some, and obviously with our managers and with Terry. And so the question becomes, you know, what is the role of the committee or the board when it comes to executive oversight? You know, at what point, it's an honest question, and it's a philosophical one. I would say, I guess my own thing would be, if the finance people and the administrator go through this stuff, and the questions are asked, I think that's what we get paid for. But I'm wide open, Laura. You can always call me or text me or email me and give me whatever thoughts you have about what more detail you're thinking of.
Yeah.
I just want to echo what Pete's saying. Sometimes more detail is not good. You know, there are some people who want to see all of it and can digest all of it, but a lot of people don't want that, and you overwhelm them when you give them too much data. So Pete is trying to cut a fine line here between giving you enough detail and answering questions so you know what's going on, but not enough to overwhelm everyone. So,
I
if
get
any
that for the general, and you know who asked the question about the details, so it was
Yeah.
me.
Yeah.
So we already
Well, no,
know.
but you're not the only one,
I
Laura.
already
There's
like more details, so.
Laura, there are other
Yeah.
board members that like more detail too, though. But
Yeah.
you know as
Yeah.
well I do, there's some who don't want it either. So where do we draw the line is the question.
And yeah, Laura, we can always talk offline, and I can get your ideas, and I can try to you know, throw something together that has something more. I'll just need to hear what you're thinking.
Yeah, okay.
This is what we'll, whoops, I'm sorry, go ahead.
Was there somebody else that had a question? Guess not. Any other comments or questions about the budget for next year? Otherwise, we have a motion and a second to approve it and submit it to the finance committee. All in favor, signify by saying aye or raising your hand.
Aye.
Any opposed? Motion carries.
Clarence, I have a question. This is Laura
Oh,
Cruz.
go ahead, Laura.
For such a motion, or do we need to have a roll count because it relates to money? I'm just asking a clarifying question.
No, only the county
I
board
don't-
needs to have a roll call.
Yeah, I don't think we need to do a roll call. I mean, we're
Just checking.
Yep.
Thank you.
all right. Next item is the 2022 year-to-date expenditures.
Okay, can you see this exhibit now, or are you still looking at the old one? Do I have to unshare and share again?
Nope, we see it. At least
Okay.
I do.
It says year-to-date July revenue and expense analysis. Right?
Yes.
You're
Okay.
good.
So, here, here again, the top line, I'll run over the top line briefly, and then we can kind of I'll go down like by department, and we'll talk about where we might have some struggles and where we probably will not. Right now, we have used 30% of our annual debt levy. Not surprising, that's would be a pretty typical number. Once again, overall, the things that we have the most control over, personnel, travel and training, those things are well in line. Overhead too, we have a fair amount of control over that. So as always, the bugaboo for us comes in under these other direct expenses, and included in these other direct expenses are out-of-home placements, that's the struggle. Virtually everything we do, as you guys know, is court ordered, and those out-of-home placements fall into that for sure. So it's difficult to know how many we're ever going to have, what level of facility is going to be required to take care of this person and to help them. How many are we going to have and for how long? So that is an ongoing struggle. So this is year to date through July. Like I said, we look okay right now, but there's some weakness here, so we'll talk about that. Adult services, this group, this department should come in pretty close to budget. I would expect them to be really close or slightly over. Again, it depends that we've got one client in a state mental health hospital, and that person does get some funding from Medicare and another source. So we get a little bit of relief there, but depending on how long that person is there, that could cause some trouble here. But as of this moment, I feel like adult services is gonna be pretty close to this roughly $500,000 in levy request for the year. The ADRC, Aging and Disability Resource Center, this is not going to be a problem. We will be at or below that levy request. I'm virtually sure of that. Children and families, let's come back to that because that's where we've got a struggle there. The community service programs, this is the CCS and the CSP we talked about. You can see this levy need is not tracking anywhere near what we thought for the year. That is actually going to stay pretty true, and that's because haven't been enrolling people in the CSP program, which is the program that was only approximately 60% funded. So this one also, I feel like will be below our levy request and probably substantially below for the year. Economic support, these are, at least for Ashland County, the way the operations here and the grants here have been pretty darn stable for years. Here again, I expect that we're going to come in, right around this 129,000, probably somewhat below that. So economic support is not a concern. Public health, for again multiple reasons, this again is going to come in pretty significantly below the levy budget. We've got funding. Liz has got quite a lot of funding through for COVID related things. And that is helping a lot. You can see right here, our budget for grants was $157,000 for the year. We've already through July received 223,000, and that's because of that COVID money. So this is going to be a place too, kind of like CCS, and that's also reflected in that busy budget exhibit I showed you before. You know, the community service programs and public health for next year also are the places where you're going to see lower levy requests, and you can see that bearing out in what's actually happening this year. So public health should be pretty significantly below their levy request. Child support, we didn't talk about them in the budget, but what's happening here, I suspect that child support is going to be over this budget. Our request, it was 79,000. We're already at 61,000 in levy. I expect that Kelly and I have been working on that and digging into it. What's happening with child support is due to their part of the funding that child support gets is based on certain performance metrics. And over the course of this pandemic, and this is statewide, you know, Ashland County and every other county hasn't been able to fulfill their performance. And in some cases, I believe Kelly can always speak up, but I believe it's because, you know, certain things were during the pandemic kind of suspended. You know, they weren't required of people to pay certain child support under certain cases. So what that means is, and that revenue, that performance revenue piece comes on a lag. And so when you start 2020 and 2021, now that performance revenue from those years is lower. It's starting to come down. So that's what's happening in child support for this year. And we've reflected that in the budget for child support for next year, is this child support will be over our requested levy by, I don't know, it's really difficult to guess, but I would guess maybe end up maybe $20,000 over. So that's what's happening there. So net with all of those departments, we will be probably pretty significantly under budget, but we've got a situation, and I'll let Terry talk about it. We've got some kids, again, down here, I'm back at Children and Families, other direct. We've got some kids that have been placed in the last few months in some very expensive placements. And the chances that they leave those placements in 2022, from what I understand from talking with Terry briefly, is probably not good. And so here's I'll give you a little bit of information. 3 placements. We've got one child whose total, my kind of best guesstimate of the total cost for one of these children for 2022 will be about $87,000. Another child, the total cost for 2022, as far as I can guesstimate, will be $78,000. And there's a third child who we've had for some years, a few years anyway. Again, Terry can talk some more, but that total cost for 2022 is probably going to be in the neighborhood of $200,000. And so these are the sorts of things that we've talked about over the years where out-of-home placements are not in our control, and the level of care they need. For example, the child who needs the level of care resulting in $200,000, that's clearly a higher level of care than the other two. Those two are clearly higher than the vast majority of our kids. But as we've talked about in years past, you put these budgets together and all it takes is one of those, and that really, really, really hurts. So I'm guessing, again, it's a guesstimate. My best somewhat educated guess would be that children and families will probably be over that levy request by a couple $100,000 probably because of this. That would just be my best kind of ballpark. So yeah, those are tough situations.
So the youth that Pete is referencing, we had in Illinois the year before, and they discharged him back to us. And the closest place we could find was Pennsylvania to take this youth. He's actually doing much better now, but nobody will take him because of past behaviors. There's a shortage of residential care centers for children in Wisconsin. Some are closing, and the ones who aren't closing they can pick and choose what kids they take because we don't have enough in the state of Wisconsin. So they take the easiest children, and this is statewide that this is being experienced, and the state is aware of it. They are putting together work groups and trying to incentivize people to take these difficult youth. They also are creating a brand new facility called a psychiatric treatment facility for youth, but that's going to be a couple years down the road. But that's exactly what we need. At least we're moving in the right direction. This particular youth may come off our responsibility because the family has moved to a different county. So we might see some relief next year. Unfortunately, the county where they moved to will be, footing the bill for this. So one of the things we're looking at, and I just want to plant a seed, is we are currently really seeing what Oneida County is doing. For years, Milwaukee County has been able to have what is called professional foster parents, where the intention is at least one parent does not work out of the home and is paid to just take care of this youth and paid a good salary and enough benefits above and beyond a good salary to purchase their own insurance and things like that. Obviously, it's a very special skill set that could take some of these difficult youth, but there is a way to do it, and Wisconsin is looking at, Milwaukee County has done this for some years, and we're looking at how they've done it. Unfortunately, Milwaukee County has a lot of resources that we don't have, that they are able to really put into these homes and support those parents. And we just don't have providers up here right now, but that's something we would be exploring. And if you can imagine, if we paid one family $70,000 a year to take care of this youth, that's almost a quarter of what we're paying. And he would be in a family setting, not an institutional setting, and have really one-on-one attention. So we're looking at all options, and we're exploring a lot of different things in times like these. we need to be creative, and so we're looking at some alternatives, but right now there aren't a lot of options, and we have a lot of kids with very, very complex needs, both kids who have been abused and have some mental health issues, or very, very behavioral issues, sometimes sexualized behavior, and some youth who are basically creating or participating in crimes, but they are not competent. So they get charged and they are not competent, and we can't do anything. And it's creating this cycle of just kind of in and out of the system. And nobody will take this particular youth because of his behaviors, his criminal past, and his IQ. So lots of complex youth right now. And so that's kind of the high level overview if you have questions.
I have one,
No
Terry.
question.
Oh, go ahead, Laura.
No question, just I know I saw this very particular issue at WCA the other day. And so the state is very aware of it. WCA is aware of it, and they're pushing on it because this was quite a big part of one of our breakout sessions. So they didn't seem to have anything any better than the things that we're already trying and that you have mentioned. So
Yeah, I'm glad that you were there and were involved with that, Laura, because this has been a struggle for I've been here 10 years, and for almost that whole time, counties around the state have been fit to be tied with how to deal with out-of-home placements, children and adults, because there's virtually no way to plan for it. The last few years now, I would say 2 or 3 years, we've kind of, I hate to say skated by because it's cost us a lot of money, but it's been enough where our funding has helped, and we haven't been wildly different from what our levy request than what we had budgeted. But I remember, 5, 6, 7 years ago, I mean, we had a couple years like this where, and this, my bet, lots of moving pieces here. It's really difficult to forecast, but my best guesstimate here would be overall for human services that it's probably going to end up, pushing us a couple $100,000 over this levy request. That would just be my best guess right now.
Dan, did you have something to say?
Yeah, I just want to know, are we seeing an increase in problem behavior with children since COVID started?
Yes, we have seen a significant increase in youth justice cases being referred. And we've always had significant levels of youth justice referrals, but the crimes they're committing now are much more significant and more dangerous and involving weapons. And it's correlated directly with the pandemic.
So just conservatively speaking, we can probably see more of this kind of incidents occurring.
Well, I heard some really good news from the school district today, which was things have gotten off so much better than the beginning of last year. I think there was such a not being able to socialize and learn those social skills and interact with people and just have the normal societal cues of what is good behavior, what's bad behavior, just everything that the school and their peers and teachers model for them, it just caused people to just lose all the social skills they had. And then I think last year, and Laura Cruz could probably speak to this better, but I think the more they finally got back into school, and of course, we know that a lot of kids, even after school was resuming again in person, didn't go to school. This year, their attendance is double what it was last year in the beginning of the school year. So I have great hope that, they will relearn those skills, re-engage with their peers and their teachers. And then, of course, we always hope they will do lots of pro-social activities, including our Brighter Futures initiative, and really find things to do that are, like I said, pro-social, and not have all this time on their hands to get into mischief. So I think it is going to be better.
Oh, thank you. That's good news to hear.
In that session, and I'm pretty sure it was a Rock County, or not Rock County, but LaCrosse County, they do a lot of data pooling, and they had worked with the school district and found that diagnoses of ADHD, autism, things like that, they had to start looking into that because it seemed that all those diagnoses were jumping, when maybe that was a little more of the effect of more HHS issues inside the house. Being just those, maybe they did have ADD, or ADHD, but because the family structure wasn't as strong as it could be, that aggravated that. So they're acting out, and especially the riskier behaviors, and some of these can be seen as attention seeking, like sometimes the worst kind of thing that someone does, they really want someone to come in, intervene in their kids. They don't know how to have those skills to ask for that. But their HHS was working with the school district to see if they could identify that and try to do all those intervention things on the beginning. So, and I'm sure you guys have looked in at different pieces of that. I know they'll have the recording of that up soon from WCA, which it was, like I said, one of the ones I hit because, I know how much we stress over these placements and trying to keep that family structure together and such, but trying to identify it before it gets to the people hurt and children shipped off because we don't have any other choice. If we could build that partnership, there's another couple data things that LaCrosse had, but I'll save that till later.
Any other questions or comments on the budget and the revenue and the expense report?
Like always, I say this every time, but feel free. Laura talked a little bit about it with the budget, and if anyone wants to, get in the mud and go through some of this stuff in more detail, I'm always more than happy to do that with people. So just get a hold of me.
All right, thanks, Pete.
Yep.
Thanks for all
Next
your work,
item.
Pete.
Yep.
Next item is the public health grant.
So I just wanted to give Liz huge kudos for finding some money for things we needed to pay for anyway. And I believe one of them was, I don't know if it went to executive or finance, but we had identified some need for security cameras at the Sanborn building, which we've never had before. And me in my head was thinking a Ring doorbell like $100. Well, it turned out to be $16,000 because I'm not an IT person and we have to back it up and needed all this stuff. So my little request for security cameras came in very expensive. And Liz has found some funding for that. And also the ramp to the handicap ramp to the public health door entranceway has been rotting severely. And it's literally falling apart. It's structurally sound except for the handrails. But she's able to use some of that funding for that also. And then she has a very creative idea for a vaccination clinic in the storage unit. And Liz, did you want to just talk about what your vision is and what you got approval for?
Yeah, my kind of out of the box thinking in some ways. So as Pete had mentioned, we do have some different lines of funding coming specifically to public health and, in part as COVID relief. And one of the funding sources that we have is a grant. It's actually ARPA funds specific to public health. And the grant amount is just over, if I remember correctly, it's just over $300,000. So there's a very specific scope of work for things that we can use this funding source for. It applies in a lot of ways to a lot of different things, and it's kind of a general but specific at the same time. So you kind of have to go through and kind of pick things apart a little bit to see what you can and can't do. And as Terry had mentioned, we had gotten these specific things approved as far as improvements to existing structures and building upon infrastructure that we already have. And one of the things that we were looking at doing, because just as an example, our drive-through flu clinics that we do, that we've done for the last couple of years, have been so successful, and everybody seems to be very appreciative, especially when it's later in October and it's raining and snowing and nobody wants to get out of their vehicles. So we're standing outside in our lovely little blue tent that we have to provide vaccinations to people. The problem with that is then we're saving our community members the trouble of having to get out into the elements, but we're freezing our butts off. And then it also adds that extra added element of making sure that our vaccine is not actually freezing, because we have had incidents in the past where our vaccine has been near frozen, which then makes the vaccine not necessarily viable because you're looking at a temperature excursion. And also it adds discomfort for the individual receiving a frozen vaccine or nearly frozen, because that's not comfortable either. So one of the ideas that we had was to essentially look into and build or purchase like essentially a tiny house that we would be able to put on the property kind of adjacent to where our parking lots and driveway kind of go together. So we would be able to utilize this as a drive-up vaccination station, or if we were to have other events, we could kind of host other events out of it. So it would be a shelter from the environment for us. And then, it would facilitate vaccine storage for those specific events. So we don't have to worry quite so much about the temperature excursions. And then when those events aren't going on, it would also allow us additional storage for any of our signage, the poster boards, anything like that that we would use, or any of the excess surplus of things that we'd be able to help accommodate for some other departments to store some of the things that might otherwise be taking up unnecessary office space to better utilize our resources. So. Any questions on that at all?
Hearing none, we'll move on then to CCS CSP move to the Sanborn Avenue building.
So just in brief, I think you're all aware that we had some concerns with the downtown building at 514 West Main Street. Val and her team have been keeping an eye on how tiles in the ceiling have been shifting and falling, and different walls are pulling away from structural surfaces. They've been measuring things. So Dan was able to get a structural engineer and an architect to come and look at the facility. And it has been deemed unsafe, and we quickly, very, very quickly, within 2 weeks, moved everybody and their important equipment, all their files, their desks, their computers, their chairs, to the Sanborn building. We had a plan in place in case this was in fact what was going to be the outcome of that survey. And the highway department took 2 days to move us and did a fabulous, fabulous job. And Rachel worked many, many, many hours of overtime and got everybody hooked up almost seamlessly. We were technically down 1 day where staff did not have access to their computers, but they still had, in many cases, access to cell phones or other telephones. They could do home visits with the clients. We are packed in like sardines, but everybody is in a safe building right now. And there will be some growing pains as we get used to it. But just to let you know, the downtown building is closed at this point. All of the members that we serve have been notified, and the state actually did a virtual inspection of the facility at Sanborn Avenue, and we passed with flying colors, and so we're good to go.
Yeah, the report, we did get the report back from the inspector, who did recommend everybody leave. And thank you, Terry, for making that happen really fast. It's looking like the cost to fix that building is going to be $800,000 or more if it's not local people doing it. If people have to travel, add another 20% to that total. So the executive committee will be talking about this tomorrow, and whether or not we keep the building, I don't know.
Any questions for Dan or Terry?
No questions, just there was at WCA, there was some of those engineers and firms that did have access to grant writing and such that might be able to help deal with that. Might be something we'd want to put past a couple of them to see if they could help write for funds for something like that and do that as a separate project. But that was something I was going to bring up in PPLE, which is going to be on next Monday.
All right, then we'll move on. Complaint policy update.
Okay, this was in your packet. It just, we've been given direction by the state of Wisconsin Department of Children and Families that we needed to comply with their new policies and procedures for a complaint process. They sent us a model to use. You could tweak it how you wanted. You could retweak the one you currently had and submit it. It would have to be approved. Basically, we took their model. We made the changes to make it Ashland County Health and Human Services, and we are just requesting that you approve that, and we will institute it, and I will tomorrow, if it's approved, submit it to the state for proof that we are complying.
This is Laura Cruz. I move to approve.
I'll second that motion.
Motion made and seconded by the two Lauras. Any other questions or comments? Otherwise, all in favor signify by saying aye.
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 Yes. Opposed? Motion carries. Staffing updates.
Okay, we continue, excuse me, we continue to have turnover in our agency. I will try to save some time and just highlight some of the positions that are crucial within our agency. Melanie Connors has, so she's our economic support supervisor. She has accepted a job with the state of Wisconsin. So we're very, very happy for her, but we're very sad she's leaving us. They are gaining an excellent worker. And rather than, I'm not sure exactly how many programs Melanie runs right now and is responsible for knowing. She, I'm sure, knows off the top of her head, but it's many, many. She will just be responsible for one. So I think that's a huge relief for her, and she will excel and exceed in that. So we wish her the best. And we have hired internally for Amy Piketty, who was already a lead worker within economic support. She's on your screen, just waved at you. She has been promoted to take Melanie's position and has been shadowing her for the last couple of weeks. Melanie's last day is this Thursday, September 22nd. And we also have, for those of you who haven't heard, Pete Hurlevy has tendered his resignation as well. And his last day will be October 7th. Huge, huge shoes to fill there. We just finished interviews today, and we have a couple really good candidates. We're hoping to be able to make an offer for that position by the end of this week so that that person can do some shadowing with Pete before he leaves as well. And then when we had put this agenda together, we had the next agenda item 12, which was a request for the additional CLTS CST worker. That is a children's long-term support worker and a coordinated services team worker. And somewhere between putting the agenda together, it crisscrossed over executive, and this has already been approved. But we got approval to hire another children's long-term support worker. It is fully funded between children's long-term support and our mental health block grant. And just to give you a little bit of information, although children's long-term support is not an entitlement, they say, it is effectively an entitlement. We have to serve every child who's eligible, and we have to do the assessment and get them services within 45 days. The good news is the state of Wisconsin pays for that, which they hadn't been previously. So if you served more children than your allocation, you were responsible for that. So overall, it's a really, really good thing, because this is a piece of prevention we can do when kids are young. They have to be at an institutional level of care, but we can keep them in the community and hopefully put enough services in there to keep them in the community and to help them at times rehabilitate, or at least habilitate them so they can stay with their families.
Any questions? So can we skip the next one then?
Yes.
Since it's been approved and hired.
Yeah.
So then we'll move on to recruitment retention issues.
So kind of piggybacking on what we were just saying, we have had a lot of turnover. A lot of the time, I will say, as you've heard recently, we've lost some supervisors. We lost Jenny McBain to the state, Laura Compton to the state. We're losing Melanie Connors to the state. We do a really good job, I think, of mentoring and really helping people meet their vocational goals. And, you know, we want the best for them. So in those purposes, that is great. We are not competitive in any way or form with the state of Wisconsin and their benefits. We know, and I think we'll find out obviously tomorrow, we are not competitive with surrounding counties. We know that just kind of from surveys that we've done with other county members. The one thing that I would say that could help, I think the wage study will help a lot, but what I'd like to throw out there is we currently, these are all, every health and human services job that we have is pretty significantly taxing on people. We're removing children, we're dealing with mentally ill folks, we're helping substance use folks. It can be really, really difficult and cause anxiety, secondary trauma. lots of different things. And currently, our employee handbook does not allow for any vacation the first year, 0. You earn 1 week after one year of working. Bayfield County, who is, our neighbor and 10 minutes away, when they hire new workers, they start off with 1 week of paid vacation, and after 1 year, they advance up to 2. So it's something I would like this board to consider moving forward to executive, to consider that as part of our employee benefit package. We know that Bayfield County pays a lot more than us. I think we have a very good work culture, and we do our best to be flexible with our staff. And that, I think, has helped us maintain a lot of good workers. But at some point, people are going to be looking at the advantages of driving 10 minutes, making a lot more money, and getting vacation off the get-go. So if this board would agree, the action request would be to recommend to the executive committee that we follow the same vacation schedule as Bayfield County.
This is Laura Cruz. I move to approve.
Point of clarification, we don't have this as an action item on here, do we?
Yeah, it
Yeah.
is.
It is, yep.
Right.
I want to say I agree with Terry, and I'm planning to bring this to executive in any case.
Is there a second to Laura Cruz's motion? George has raised his hand to second. Now, any discussion?
This is Supervisor Huber. That means that we have to give all Ashland County employees the same thing, right?
Yes, that's correct. It would be all Ashland County employees.
Okay, thanks.
Any other questions, comments?
I just want to echo Terry and just say this. When I applied in 2006, there was over 100 applications for the position that I applied for. The last hire I did for 2 positions and economic support, I got less than 10 applications. So we need to make some transition. Like I said, when I applied back in 2006, this was like top-notch employment. This is where you wanted to be. And again, when I hired less than a year ago, I had less than 10 applications.
So my question is in relation to the recruitment and retention issue. Is that across the county in all positions, or is that a function of like Health and Human Services, where there's really high turnover because of the secondary trauma and the massive workload?
No, it's close to the same percentage wise. HHS sees more of it because they have more employees. Well, we have been having a lot of turnover in the clerk of court's office and the DA's office, highway department. It's really county-wide. And when we talk to the employees, almost to a T, they say that it's benefits and pay that really are what's driving them to search elsewhere. And I'll be honest, I mean, the private sector out there is paying a lot better than we are. So it's, the wage study, they're going to have some numbers tomorrow. So it's a lot of money to get to where we need to get, but we're going to have to look and use some unorthodox methods, and we need to look at the benefit schedule too, to compete. Otherwise, we're never going to get people to work here.
Right. And the other thing, this is Laura Cruz. The other thing is it costs a lot of money to rehire and retrain. And if we can keep retention, that's going to be saving, although oftentimes I feel like those things do not show up on the spreadsheet.
Well, you're right. They don't show up on the spreadsheet. And, Pete, you're right, probably nobody's ever asked you this, but do you have any ballpark guess about how much all the constant training costs? I mean, just ballpark
Yeah,
it.
it's difficult to say. I mean, I don't know. Those get to be a little bit slippery because you say, I mean, unless you are literally, which maybe we are in certain departments, unless you're literally paying money to somewhere to that you would not have paid, it's slippery to assign a dollar amount to that, because I think at least I know that some departments have formal training that they have to go through with the state. Economic support for sure, children's for sure, and I'm sure there's some adult too. The cost, if there's cost to us where we literally have to pay for that would probably be the easiest thing to identify. But it gets real slippery if you've got employees, our own employees doing some training. It's hard to.
Yeah. Well, there's definitely time lost.
Sorry, Dan. I just wanted to piggyback on that, Pete, because this is Kelly from Child Support. When we have to retrain somebody, like we lost a really good worker to Bayfield County, we have to take on that caseload of over 500 cases until they're trained and can do it. So we're raising our caseloads by 250 cases each. So now we're managing almost between 700 and 800 cases, and our performance goes down because it's impossible to manage that. And then we get our funding based on our performance. So a whole year of, it's like a trickle effect. And right now we just hired a new child support specialist, and she has 4 children and a special needs foster care child that she takes in. And I actually brought this up to Terry, asking her to bring it forward because she has no time. So this little boy has an appointment in the cities, and she doesn't have any time to take him. And she's an amazing worker, and she has caught on so fast. I mean, it's a shame to lose somebody over having to make a choice whether you take your child to an appointment or you go to work, because you're not going to get paid because you have no time to take. And that's for a whole year. So anyone with children knows their children are going to get sick at least once or twice in a year. And that's not even including yourself. So I support this 100%.
Any other questions or comments? Otherwise, we have a motion to approve the request to change the vacation schedule to newly hired employees and submit it to the executive committee. All in favor signify by saying aye.
Aye.
Aye. Yes.
Any opposed? Motion carries. Public health, the COVID-19 and other updates.
I don't think she heard you.
Are you
Liz,
there, Liz?
we're on public health updates. I lost your video now too.
Yeah. Well, I can tell you what she kind of mentioned at partnership this morning was the amount of formal lab tests that are coming in are still showing significant levels of COVID, which is why we did this virtually today. And also, that doesn't include all of the over-the-counter tests that we are hearing is you know, there's lots of positive cases out there. She's also dealing with some potential monkeypox, contact tracing, and also doing vaccinations for that as well. And she just texted me and said her computer just died. But what I can say is they are continuing to keep up with everything. They're scheduling flu clinics and scheduling a vaccine clinic with the new variant vaccine in it, and moving forward, and they're doing great.
All right, thanks for that update. Then we'll move on to the 2023 proposed meeting dates.
So those were in your packets as well, and they are still the third Wednesday of the month of February, June, September, and November. And again, come November, we tried to make sure we weren't in hunting season or Thanksgiving, or at least not Veterans Day and Thanksgiving. So it's in between that week for everybody as far as their holiday goes.
I have a question on those. Is there a reason why we just don't do May and August with those middle two, that we kind of stretch those out a little further than just quarterly?
We were given the directive a long time ago to not have more than 5, and we had one scheduled in April, but every other year that conflicts with the new county board and their electors, and last year we had to cancel because it was such a short turnaround from the time the election was done that they weren't appointed to our committee yet.
What if we do a May and August in the middle of there? Kind of gives a little more time in this. I mean, I guess it squinches the time for budgeting preparation, but it gives a little more time between August and budget time.
That June meeting is our public hearing meeting where we, you know, have a public hearing for working on the budget.
Mm-hmm. And that's statutorily
So we
required.
can't delay, you know, we can't really delay that.
Couldn't we do it in May? It just for as big of a department as what this is, and for us having 4 meetings to get this all done. And sometimes it feels like we just hear about what happens instead of hear about planning kind of stuff. It would.
We can put another one in there. You know, when Jeff was here, that was the mandate. We couldn't have more than 5. So we pared it down to 4. And that would be up to this committee to decide if you want one more, when you want it.
Hi, this is Laura Cruz. I kind of agree. I think that, first of all, those people who are on just starting the committee, there's a steep learning curve. And I think by having another meeting each year added to that, then, you know, in addition to, you know, hearing what's going on, then you can also, we can have more questions, talk about some of the planning stuff that's happening. And, you know, so I just think that that's a good idea. Not that I want any more meetings. However, if it's beneficial, it seems to me that that's what kind of action we should take.
As a general rule, this committee can decide how many meetings they want to have. So as long as you guys want to schedule 5, you can. If you want to schedule 6, you can. If the chair wants to schedule additional ones because they're needed, that's his prerogative.
Do we want to take a look at this and maybe postpone it until the November meeting as far as setting our schedule?
I would support that.
We can do
This is
that.
Laura Cruz. I would too.
So I don't think we need to make a motion then, as long as we don't have a motion to approve that meeting schedule, we can just move on and it can be put on the November meeting agenda. Does that sound all right?
Sounds great.
All right, then we'll move on to written materials. Anything we should take particular note of, or any supervisors want to expand on that? Any of those materials? Or any questions about any of those that were in the packet? Otherwise, our next item is board member updates and agenda items. Anybody have any suggestions for agenda items for upcoming meetings? Laura?
Here's that other piece of that La Crosse County data that they seem to be very, very data driven. One of the pieces that they pulled that was intriguing to me on a couple different levels was also besides the child placement stuff, starting to show correlations with in the schools with the ADHD, tracking that and referrals. There also showed that there was in the elder population with 911 calls, seniors who have a tendency to need more HHS services, you know, or all of us wonderful people combined, have a tendency to call 911 first. So they don't have food, they call 911. They are having a problem getting to a doctor's appointment, you know, but and I'm thinking this could be a good collaboration between HHS and at least our sheriff's department if we continue to have our dispatch and such, but we could still pull numbers. I think a lot of that data would help you guys be able to do, and this was, like I said, in another one of these sessions at WCA, we all know, including with the youth, the sooner we get on this stuff and recognize these signs, the quicker we can get people looped into the services that they need. And I think that's our biggest plan here, is to try to catch everybody on the front end instead of, you know, when somebody's having problems. So I'd like to see some more collaboration in with that. I am going to bring it up at my PPLE meeting, which I may just have that thrown on there too, is to talk a little more about data-driven services. So I would be really interested to talk to you about it, Terry, and see if there's a way that between you and the sheriff's department, we could figure out something like this to get on that front edge. And I'm sure that's not the only thing that could be benefited with the partnership between the two. I know there's been a couple other things, so I wanted to bring that one up.
Sounds good. And Laura, if you could, if you're allowed to, could you share the link to that so I can view it?
Yeah,
Okay,
as soon as they post those, I will definitely, because I thought all I could do was think of you guys every time they talked about this data. It's like, yes, let's get on this and help more people quicker. So
Okay, sounds good.
Clarence, this is Matt McKenzie, if you can hear me.
Yeah, go ahead, Matt.
I guess I'd like to see us look at some sort of ordinance directed against people targeting elderly or cognitively challenged people within our county with any kind of scheme, be it phone or, you know, direct contact. I think it's something that we should explore. It may not be easy for us to prosecute somebody for it, but make a clear statement that we shouldn't tolerate it here.
Okay. I see Liz has joined us again. Terry kind of summarized the public health COVID-19 and other updates. I don't know if there's anything, I don't know if you heard any of that or if you were still trying to get connected again, but I don't know if there's anything you wanted to say about that.
Yeah, my apologies about that. My computer came unplugged and the whole thing just gone all with once. So very, very bad technical difficulty there. So yeah, I guess just as summarizing, we are starting flu season vaccinations. So the month of October is traditionally very busy for us, as it will again be this year. We have clinics scheduled, including several different drive-through clinics. We will be visiting the senior meal sites to provide clinics throughout the county. I believe we have all of the schools scheduled for vaccinations in the schools as well as private businesses. And then the school-based vaccinations, we're offering the flu vaccination this year, as well as any other of the recommended childhood vaccinations. So if anybody's behind on vaccinations, anything from MMR to varicella, HPV, Hep A, Hep B, we have all of the recommended vaccines that we're able to provide in the school setting. And then just for the COVID vaccination update, we are taking by appointment at this point in time. We do have a walk-in clinic scheduled for the 27th for the updated boosters. And then outside of that, we'll be doing, we're kind of designating our Wednesday afternoons to do by appointment, just because with all of the flu vaccination clinics, it's very difficult to have additional clinics worked in there. So we're going by appointment, probably on Wednesday afternoon. For the updated boosters, we are offering the Pfizer vaccine right now. We were limited as far as ordering any Moderna vaccine, as there have been shipping delays at the federal level. So the Pfizer and the Moderna vaccines outside of the primary series are interchangeable. Either one of them, as far as the booster, is completely acceptable. So we are going with Pfizer, as that is what has been available to us and what we have been, the majority of our vaccines that we've provided so far have been Pfizer. So that is what we are continuing to go with. And then just a quick update as far as COVID cases themselves. Since over the last week and a half, we've had 33 laboratory confirmed cases, with the availability of the home antigen testing to individuals, whether it be, the mail order ones purchased over the counter. The schools have availability for them. We have availability. If somebody needs them, they can call and we can arrange for them to come in and pick them up, that sort of thing. Those tests aren't reported generally, and with the way the state records the numbers, they're not necessarily counted into the numbers. So when I say there's 33 lab confirmed cases, those are the ones that have been done through an actual laboratory, though that is not counting the home tests. So it makes it very difficult to get an accurate picture as to a concrete number of cases that we've had on any given basis. So with that, the CDC is classifying us as a medium activity level at this point in time. And we continue with high levels of community transmission, just based on what the numbers are that we do know of for sure for confirmed.
All right, thanks, Liz.
Yep.
Any other board member comments or suggested agenda items? Any other business? Next meeting date, November 16th. And we'll see whether it'll be in person or we'll still be on Zoom at a later date. And now we are in line for a motion to adjourn.
Laura Cruz, move to adjourn.
This is
Second.
Huber, I'll second it.
Motion made and seconded to adjourn. All in favor? Signify by saying
Aye.
aye or waving your
Aye.
hand.
Aye.
Aye.
We are adjourned. Thanks, everyone.
Usual, great job, Clarence.